I think we're talking about names. So if you and I are going to talk about John, it needs to be the same John that you're talking about and I'm talking about. So names are important. And just to illustrate, in science there can be confusion. And sometimes names are given or change their meaning over time. And we should be careful about that. So as an example, we talk about Alzheimer's disease and we talk about Down syndrome. But actually Down syndrome is not a syndrome, it is a disease. We know what is the cause, we know what the pathogenetic mechanism is, and so on. So it doesn't make sense to call Down syndrome a syndrome. And the same thing in reverse applies to Alzheimer's disease, because what Alois Alzheimer described more than 100 years ago is a case of early-onset Alzheimer's disease, early-onset dementia of a person who developed the disease in her 50s. And when she died, he examined her brain and found what is now called the pathology of Alzheimer's disease. But he did not think that this is the same disorder that occurs in old people. And now when we talk about Alzheimer's disease pandemia, this is actually an impostor. We take the name and we apply it to something else, and we should be very careful. This may lead to mistakes. For example, most of the animal studies that are done with transgenic mice, for example, that use the genes that occurred in Alois Alzheimer's patient. And this is an early onset Alzheimer's disease. And early onset Alzheimer's disease and late onset Alzheimer's disease are different disorders. And giving them the same name leads to confusion, and the effect that we have used these animals in order to prevent another disorder has misled us and led to a lot of investment that went down the drain. $25 billion over the years were spent on trying to find a solution for amyloid. But the amyloid is a byproduct of the degenerative process. There is no proof that it is causative, and it's and therefore I think it's important to think about it. No, I don't think that we're going to use a different term. The old term in Alzheimer's time and for 100 years or 80 years after that was senile dementia. And when I say that at the beginning that actually Down syndrome is a disease, I would also complementary say that Alzheimer's disease, old age Alzheimer's disease, is not a disease, but it is a syndrome. So it has the same phenotype and the same not only clinical but also pathological phenotype, but this is caused by different entities. So and we know what are the risk factors, what are the causative factors for late onset dementia. But we still call it Alzheimer's disease, but we have to understand and not be confused. So we know it's hypertension, and we know it's inactivity, and we know it's hearing loss. And so we know, but it's not the same combination of factors in two individuals. So in this sense, since it's multiple components, many factors contributing to it, it's not a disease, but rather a constellation of symptoms leading to brain degeneration. And this is the way we should consider it. And we should not really work against what happened, the dying neurons, but against the death processes causing it.